Miss Deborah.
Hello.
My name is Ifoma Obadike and I am a student nurse practitioner. I am going to be doing abdominal exam on you today. Is that okay? Do I have your consent to do that?
Yes.
Because my instructor is going to be watching this. I'm going to put it on YouTube under unlisted. Is that still fine?
Yes.
Okay, great. So I'm going to wash my hands. I will need you to lay on your back and ready for the examination. I wash my hands with soap or water or alcohol wipe. And I'm going to come in, and the first thing I'm going to do is that I'm going to ask you to, if you don't mind, lift up your shirts up for me so I can see your abdomen. Thank you. So the first thing I'm going to do is to inspect the abdomen for symmetrical contour and any jaundice, any scar, any mole, or the contour of the abdomen. And after I finish inspecting, I also inspect it for any pulsation on the abdomen. So the next thing is that I'm going to auscultate. And when we auscultate, you kind of marginalize and divide the abdomen into 4 places, which we call the 4 quadrants area. And I will start with the right upper quadrant. The right upper quadrant, I will listen with my diaphragm. I go then to the left upper quadrant. Then I will go down to the right lower quadrant, and then I will go to the left lower quadrant. At this point, I want to listen to the arteries. I will start with the aorta artery, which is above the umbilicus. I'll listen with both the diaphragm and the bell. So this is supposed to be in my ears this way, but I'm going to put it on my neck for this purpose because it's bothering me when I talk, so that way I can explain. I will listen with the bell. I will also listen with the diaphragm. So I will go ahead and listen to the renal artery. What I'm looking for the brood sound, and then listen both bell and the diaphragm on both sides. Then now I'm going to listen to the iliac artery, listening with my bell and my diaphragm. The next step is that I'm going to listen on the femoral artery. Because I don't want to expose my patient, I'm going to be listening on top of her pens. And in the normal life examination, without a camera, I will have to take the pens off and they go down to her femoral arteries, which is here. So I will have to go down, listen with my bell and the diaphragm of my stethoscope. At this point, after I finish that, I'm going to listen to the liver friction rub with my bell of my stethoscope, and then I'm going to listen to this, and the stethoscope is going to be in my ears. And for this test, I'm just going to leave it on my neck because it's bothering me talking while it's in my ear. So, and then after listening to the liver friction rub, I also listen to the spleen rub. So now that I finished listening to this, the next part of my examination is the percussion. So I'm going to do my percussion. You put in the 4 quadrant area. I start with the right side and I start percussing with the dominant hand placed on the patient, on my 2 fingers that is on the patient. So, and then I go to the other side. What I'm expecting to hear here is a tympanic sound, and the dull sound is heard when I go towards the organ. So when I start percussing on this side, as I go further, I begin to hear a dull sound, which is where the liver, the edge of the liver is. And I keep percussing to the, at least go down to the 3rd intercostal space and percuss further. There I will have to measure it. It need to be between 4 to 7 centimeters of the liver spleen. So at this point, after that, on this side, I'm not supposed to hear on the left upper quadrant. I'm not supposed to be able to percuss the spleen. No sound. I'm not supposed to hear that. When you hear that, it's not proper. So when I finish the percussion, I can also percuss the bladder area. The bladder, when the bladder is full, what I'm supposed to hear is the dull sound. But when the bladder is empty, like hers, it's empty because she emptied her bladder before we start this exam. And that's one thing we, as practitioners, need to let our patient empty their bladders if they can before this kind of exam. So now the next step is going to be palpation. So before I palpate my patient, I am going to warm my hands up, make sure I don't put a cold hand on her, and then I start with a low palpation. What I'm looking for is a mass or any abnormal. So I finish my light palpation, then I'm going to go into a deeper palpation of my patient. At this point, when I come to this side, which is where the spleen is, I am not supposed to, I'm trying to see if I can palpate the spleen, but I cannot palpate it. That's normal. If you palpate it, that's an enlargement of the spleen. And the same also on this side. When the patient, can I ask you to take a deep breath for me and breathe out? When you do this, you should be able to feel the liver, the edge of the liver here around this border of the patient, which is called the morphine test. And this, if the patient feel any kind of pain, is a sign of a gallbladder infection. So, and I am going to also demonstrate for you how to do a test about the appendicitis. So if the patient, if I put my hands here, it's called a rebound test, and I take my hands off right away, and the patient feel, I palpate in, and take my hands off, and the patient feel the pain. That is a sign that this might be an appendicitis. And if I do it on this side, which is called the Rowan sign test, and the patient feel the pain on this side, it's a sign that she's test positive for appendicitis. At this point, I am going to go ahead and show you how to know if you suspect any kind of fluid. So I'm going to ask the patient, can you put your hands here for me, or you use a nurse and ask them, then you push this way, and you can see the fluid push up to the other, against the other side of the hands. So thank you. And then I can also ask the patient to also, can you come to lay on this side for me, please? When she lay on this side, you can see, when you put your hands here, you see that the fluid go down to the dependent side, because the fluid is now going to come down here. So the final test, that's okay, if you can lay back on your back. The final thing that I'm going to show you guys now is on how to test the kidney. So I'm going to ask this patient to sit up a little bit, because when I'm doing the kidney, it's on our back. The kidney is right here on our back, the right and the left kidney on this side of. So, and I'm not going to do it on the cloth. So if I'm doing this examination, I will have to take the patient clothes off, because we have a camera just to provide privacy. So the kidney is right here. So what I'm going to do is that I'm going to put my hands here, and I'm going to heat, and then watching my patient to see how she reacts. If there's any guarding, ask her if she have any pain, and I'm going to do the same on this other side. If she have any pain, that is a sign that there is a kidney infection going on. So this brings me to the end of the test, of the abdominal test. Thank you, Ms. Deborah, for letting me use you for this test today. You're welcome.